How's it going, everyone? Dr. Shad here, back with another hygiene board exam video on periodontics. And in this one, we'll discuss the systemic influences on periodontal health. Systemic factors can have a significant impact on periodontal tissues, often modifying the host response and increasing susceptibility to periodontal disease. The systemic factors we'll focus on in this video are pregnancy, diabetes, malnutrition, puberty, medications, leukemia and HIV, and last but not least, stress. All of these factors can have major effects on the periodontia. Let's begin our discussion with pregnancy. Pregnancy can heighten gingival inflammation and in some cases lead to the development of a pyogenic granuloma, which is a localized overgrowth of tissue. The hormone estrogen also promotes the growth of Prevotella intermedia, which, if you've seen the earlier video on plaque and biofilm, you'll know it's a bacteria associated with periodontal disease. Our next systemic condition is diabetes, which I actually discussed more in depth in an earlier video, so I'll keep it short here. Diabetes, particularly when poorly controlled, impairs neutrophil function and collagen repair, which increases the risk and severity of periodontal disease. Simple as that. Malnutrition can also have a significant impact on periodontal health. For example, ascorbic acid deficiency gingivitis is an inflammatory response of the gingiva to plaque biofilm that's aggravated by chronically low levels of ascorbic acid, or vitamin C. This deficiency weakens the body's ability to maintain and repair connective tissue, making the gingiva more susceptible to inflammation and bleeding in response to bacterial plaque. Next, we have puberty. As you can imagine, during puberty, increased hormone levels, particularly estrogen and progesterone, can lead to an exaggerated inflammatory response to plaque, meaning gingival inflammation may appear even with minimal plaque accumulation. Now, males going through puberty can also experience this, but the effect is much less pronounced with testosterone, so this is certainly more common in females. Now, in case-based scenarios, you'll want to pay attention to the patient's age and developmental stage to catch this one if it comes up. Alright, next we have drug-induced gingival hyperplasia. Certain medications are known to cause gingival enlargement as a side effect. These drugs can stimulate an overgrowth of gingival tissue, especially in the presence of plaque. Now, if a patient is really unable to maintain proper oral hygiene, sometimes modification of the medication under a physician's supervision is needed. The three main drug classes associated with this condition are anticonvulsants, such as phenytoin or dilantin, and these are commonly used to manage seizures. Calcium channel blockers, a class of antihypertensive medications, with an example being nifedipine or Procardia, and immunosuppressants, particularly cyclosporin, which is often prescribed to transplant patients. Moving on. Systemic conditions like leukemia and HIV essentially weaken the immune system to a point that the body has a hard time fighting back. For leukemia, this can manifest as gingival enlargement, bleeding, and increased vulnerability to periodontal breakdown. In HIV, you'll typically see this linear gingival erythema instead. Lastly, we have stress. Now, every one of us has experienced this one to some degree. Final exam season comes up, cortisol levels become elevated, and right after you take all your exams, you notice a cough or a sore throat. That's because stress suppresses immune function through increased cortisol levels, and this results in delayed healing and heightened susceptibility to infections. And with that, we're done, guys. So let's reinforce everything we just learned with a practice problem. Each of the following medications is associated with drug-induced gingival hyperplasia except one, which is the exception. As always, pause the video if you need some time, but the answer is D, metformin. This should have been an easy one, guys. Remember, drug-induced gingival hyperplasia is associated with three main drug classes: anticonvulsants, immunosuppressants, and calcium channel blockers. Metformin is an anti-diabetic agent, and it's not known to cause gingival overgrowth. Therefore, it's the exception in this list. Alright guys, as always, here's a quick summary of the topics covered in this video. Thanks for watching, and see you next time.